In this video, we're going to be talking about a book called What Every Pianist Needs to Know About the Body. Before we get into the video, I really recommend checking out the book. It's a really great one, and I won't be covering every single thing said in the book. I'm just going to summarize the chapters. So let's get into it. Now we're going to talk about the wrist. So the wrist is both a joint and a structure. As a structure, it lies between the forearm and the hand. It is composed of 8 bones called carpal bones. The carpals are arranged in 2 rows of 4. The bony lump that you see behind your little finger, that is the end of the ulna, and it marks the end of your forearm. The wrist is right in front of that lump, closer to your hand, and the wrist occupies about 2 inches between the end of the ulna and the hand. And if you look at your palm, the wrist structure extends about 1 inch into the fleshy part of the hand. But one thing that you have to know is that the beginning of the palm does not indicate the end of the wrist. Pianists who map the hand from the palm side is going to develop some problems. Besides the structure being about 2 inches long, it is also a joint, one of the 4 major joints of the arm. Pianists should not think of it as one joint, but a series of 3 joints. The first joint connects the forearm to the first row of the wrist bones. The second connects the first row to the second row of the wrist bones, and the third connects the second row of the wrist bones to the hand. The wrist bone articulates with just one bone of the forearm, the radius. The ulna does not articulate with the wrist bone. It just sits alongside, just as the radius sits alongside at the elbow joint. Because the first joint connects the radius to the first row of the carpal bones, it is called radiocarpal joint. At the radiocarpal joint, the radius has a concave surface. The first row of the wrist bones combine to form a corresponding convex surface, and this shape is going to permit 2 kinds of motions, up and down and sideways bending, but does not permit rotational movement of the wrist and hand in relation to the radius. The hand rotates with the radius, not apart from it. Also, the greatest range of wrist movement occurs at the radiocarpal joint, but significant movements occurs at other joints as well. Pianists should think of their wrist as long and flexible. This, along with the little finger orientation, keeps the wrist safe from injury. Now we will talk about the hand. So the hand is made up of 19 bones. There are 5 metacarpals connected to the bones of the wrist and 14 phalanges, 2 for the thumb and 3 for each of the other fingers that are connected to the metacarpals. On a skeleton, the fingers appear to be very long and they attach directly to the bones of the wrist. The reason the fingers look longer on a skeleton than on a living hand is that on a living hand, the metacarpals have muscles between them and ligaments connecting them, and they're covered with skin, which makes the hand look like a wide, flat structure with the fingers growing out of it, but the fingers actually start way inside of your palm. We should feel that our fingers do not end at our knuckles. They only end at the carpo-metacarpal joint. That is where the fingers actually start, not at the knuckles. Beyond this point, I can't really say, carpo-metacarpal joints or metacarpophalangeal joints. It's just a bit hard to say the whole thing. So what I'm going to do is call the carpo-metacarpal joint as CMC, the metacarpophalangeal joint as MCP, the proximal interphalangeal joints as PIP, and the distal interphalangeal joints as DIP. Most of the CMC joints actually move separately, but in different amounts. The motion of the 3 middle fingers is small but perceptible. Motion of the 5th finger is fairly large, and the motion of the thumb is very large. In fact, the CMC joint is the principal joint for the motion of the thumb. Therefore, pianists should regard the CMC joint as 5 joints, one for each finger. Developing maximum freedom of the CMC joints facilitates playing chords and octaves, although the amount of motions at the CMC joint may seem small. Any additional freedom you achieve here will be magnified at the tip of your fingers. So what you have to do is cultivate the feeling that the entire hand encompasses the chord or octave. You should not think of merely spreading your fingers, but use the entire hand. Another point in connection with the chords and octaves is that you should not set your hand before playing the chord or an octave. Nor in a series of octaves, you should not keep your hand fixed in a position as you move from one to another. So it simply creates tension. So what you can do is that you can allow your hand to fall on the chord or an octave without setting it in advance, and then you can play with less tension. After doing this, chords and octaves will feel effortless in comparison to how they feel with the hand fixed in a position.